So contraceptive implants is our major topic. Our outline will go as follows. We will have to look at the objectives, types of implants, mechanism of action of implants. We will look at the advantages and disadvantages. We will look at eligible candidates, those who can use implants. We will look at timing of insertion. We will have a video on insertion procedure. We will look at complications, and then we will have take-home message. Yeah, our objectives will be to describe the characteristics of implants. We will at some point apply medical eligibility criteria. Then we will have to explain the insertion, removal, and follow-up procedures. Then we will describe when to initiate use of implants and detect and manage some side effects that come along with the use of implants. Yeah, we have some key words here. Contraceptive implants are small plastic rods that are placed under the skin in the upper arm. We have two types. We have Jadel that is in place for 5 years. It's made of two rods, as you can see from the picture. We have the implanon that is there for 3 years. It's one rod, as you can see from the picture. Yeah, here I'm comparing the two hormonal implants, Jadel and implanon. In the table, you can see Jadel is for a long term, up to 5 years use. It contains the hormone levonorgestrel, which is also one of the active ingredients used in many oral contraceptives. And then when you compare with implanon, this one is a single matchstick-sized rod that contains the progesterone etonogestrel. There are two versions of the implant, naproxenon and implanon. The implant is effective for 3 years and is a good contraceptive choice for women who cannot use estrogen. When you compare the content in milligrams, Jadel contains 75 milligrams of levonorgestrel. The implanon contains 68 milligrams of the active ingredient etonogestrel. Yeah, we have a case study here. Jane is 25 years old and has 2 children. She's a first-year graduate at the University of Rwanda. She wants to have an advice from you on the most suitable contraceptive method she can use. She explained to you that she's worried about the side effects when using contraceptives, and she wants more children in the future. What is the most suitable contraceptive method for Jane? Contraceptive implants are mainly progestin-based contraception method. They are highly effective. They are rapidly reversible. They have been used for more than 25 years now. Consist of flexible tubes or rods of match-sized load. They provide 3 to 5 years of continuous protection from getting pregnant. In Rwanda, the third most common method used is the implants. This is the mechanism of action. Implants act by suppressing hormones that are responsible for ovulation. These tubes slowly releases small amounts of progesterone hormone called etonogestrel. This suppresses the pituitary gland, which stops the ovaries from releasing eggs. They act in 2 ways again, by thickening cervical mucus to block the sperm penetration. You can see it from the diagram. Yeah, now we look at the advantages and disadvantages of using implants as a method of contraception. Advantages far outweigh the disadvantages. Advantages, some of them are, it's very safe, it is very effective up to 99.9.5%. They are very easy to use. There is good return to fertility after use. They can be used by breastfeeding mothers, and they offer some health benefits, as we shall see from the next slide. Of course, they have some disadvantages, like small side effects that we will see down. They require minor procedure to insert or remove. And these ones, of course, need a skilled provider. But they provide no protection from sexually transmitted diseases, including HIV. What are the health benefits offered by implants? There is reduced risk of symptomatic pelvic inflammatory disease. There is decreased risk of iron deficiency. There is a decreased risk of ectopic pregnancy. As you can see from the two examples, the implant users, out of 100,000 live births, 6 can have an ectopic. You can see the fold times almost 10, 650 per 100,000 women using non-contraception can have ectopic. So who are those candidates that are eligible to have implants as their method of family planning? Most women can use implants safely. Most health conditions do not affect the safe and effectiveness of using implants. Many women who cannot use methods that contain estrogen can safely use the implants. Based on WHO medical eligible criteria, as you can see down, we will see the candidates that are most eligible. Yes. So here are examples. Category 1 and Category 2. Adolescent girls can use the implants. Implants can be used immediately postpartum. Implants can be used post-abortion. Implants can even be used in patients who have got blood pressure 160 out of 100. Those who are in Category 2, according to MEC, pulmonary thromboembolism, these ones cannot use the implants. History of breast cancer, these ones previously who had it can use it. Current breast cancer, these are the examples of patients who are eligible for the implants. What do we need prior to insertion of the implants or removal? When do we say that we are ready? We need to have our patient washing the arm, her arm. You cover the procedure table. You prepare a clean instrument tray. You open a sterile instrument pack. So what do we do before insertion? Wash hands thoroughly and put on your gloves. You clean the insertion or removal site. You use a sterile drape with a hole over the site. Use new disposable syringe and a needle. Here there is a video to show the insertion and the removal. It's a video. You can use it, rewind, repeat it. It's of much help.
The implant should be inserted just under the skin at the inner side of the non-dominant upper arm, about 8 to 10 centimeters above the medial epicondyle of the humerus, avoiding the sulcus or groove between the biceps and triceps muscles, and the large blood vessels and nerves that lie there in the neurovascular bundle deeper in the subcutaneous tissue. To avoid neural or vascular injury, place the implant subdermally no closer than 8 centimeters from the medial epicondyle and not over the sulcus or groove. Stretch the skin around the insertion site with your thumb and index finger. Puncture the skin with the tip of the needle slightly angled less than 30 degrees. During the entire insertion procedure, you should be able to see the insertion site and the movement of the needle. Lower the applicator to a horizontal position. While lifting the skin, also known as tenting, gently insert the needle. Make sure the needle is inserted to its full length. If the needle is not inserted to its full length, the implant may protrude from the insertion site. Keep the applicator in the same position and unlock the purple slider by pushing it slightly down. Move the slider back until it stops. This will cause the needle to be fully retracted. Have the woman lie on her back with her non-dominant arm flexed at the elbow and externally rotated. Her wrist should be parallel to her ear, or her hand is positioned next to her head. Identify the insertion site, which is at the inner side of the non-dominant upper arm, about 8 to 10 centimeters above the medial epicondyle of the humerus, avoiding the sulcus or groove between the biceps and triceps muscles and the large blood vessels and nerves that lie there in the neurovascular bundle deeper in the subcutaneous tissue. The implant should be inserted subdermally just under the skin. Make 2 marks with the marker, one mark at the insertion site and the second mark a few centimeters above the insertion site. The second mark will be used as a direction guide during the insertion. Clean the insertion site with an antiseptic solution. Anesthetize the insertion area. For example, with an anesthetic spray or by injecting 2 milliliters of 1% lidocaine just under the skin along the planned insertion tunnel. Hold the applicator just above the needle at the textured surface area. Remove the transparent protection cap by sliding it horizontally in the direction of the arrow away from the needle. If the cap does not come off easily, the applicator should not be used. You can see the white implant by looking into the tip of the needle. Do not touch the purple slider until you have fully inserted the needle subdermally, as it will retract the needle and prematurely release the implant from the applicator. With your free hand, stretch the skin around the insertion site with your thumb and index finger. Puncture the skin with the tip of the needle slightly angled less than 30 degrees. It's important that you're in a position during the entire insertion procedure to clearly see the movement of the needle just under the skin. Generally, you can see movement of the needle best if you're seated and looking at the applicator from the side and not from above. Lower the applicator to a horizontal position. While lifting the skin with the tip of the needle, slide the needle to its full length. You may feel slight resistance, but do not use excessive force. If the needle is not inserted to its full length, the implant will not be inserted properly. Keep the applicator in the same position with the needle inserted to its full length. If needed, you may use your free hand to keep the applicator in the same position during this part of the procedure. Unlock the purple slider by pushing it slightly down. Move the purple slider back until it stops. The implant is now in its final subdermal position, and the needle is locked inside the body of the applicator. The applicator can now be removed. If the applicator is not kept in the same position during this procedure, or if the purple slider is not completely moved to the back, the implant will not be inserted properly. To ensure the insertion was performed properly, check to see that the needle is fully retracted into the body of the applicator. Only the purple tip of the obturator should be visible. Place a small adhesive bandage over the insertion site and palpate the implant. Always verify the presence of the implant in the woman's arm immediately after insertion by palpation. By palpating both ends of the implant, you should be able to confirm the presence of the 4-centimeter implant. Until the presence of the implant has been verified by palpation, the woman should be advised to use a non-hormonal contraceptive method, such as condoms. Also request that the woman palpate. If you cannot feel the implant or are in doubt of its presence, check the applicator. The needle should be fully retracted and only the purple tip of the obturator should be visible. Use other methods to confirm the presence of the implant. Given the radiopaque nature of the implant, suitable methods for localization are 2-dimensional X-ray and X-ray computerized tomography, CT scan. ultrasound scanning, USS, with a high-frequency linear array transducer, 10 MHz or greater, or magnetic resonance imaging, MRI, may be used. In case these imaging methods fail, it's advised to verify the presence of the implant by measuring the etonogestrel level in a blood sample of the subject. Apply a pressure bandage with sterile gauze to minimize bruising. The woman may remove the pressure bandage after 24 hours. The adhesive bandage covering the insertion site may be removed after 3 to 5 days. Complete the user card and give it to the woman to keep. Also, complete the adhesive labels and affix it to the woman's medical record. The applicator is for single use only and must be adequately disposed of in accordance with local regulations for the handling of biohazardous waste.
After implant insertion or removal, what do we need? You stop any bleeding with the gauze and clean the insertion or removal site. You apply adhesive bandage. Press sharps in a safety container. Decontaminate instruments. Dispose of contaminated objects or decontaminate all surfaces. Wash hands with soap. You can see this one in the video above. What to remember after implant insertion? Keep the insertion area dry for at least 4 days. But you tell the mom she had to expect a bit of sourness or bruises over the site. Side effects are common but rarely harmful. As we can see, we will see it in the next slide. You tell her to come back anytime any problem arises, or concern, or desire to get pregnant. Yeah, here comes another case study. You inserted the Jadel for Jane. She called you after 2 months of insertion to say that she has vaginal bleeding, which comes at irregular intervals. So what's Jane's diagnosis? What do you do for her problem? Yes, some side effects of implants are the answers from the above question. So she has lighter bleeding or fewer days of bleeding. She might have irregular bleeding. She might have infrequent bleeding. She might not have even her bleeding. After about 1 year, you may notice some light bleeding and a few days of bleeding. There might be also irregular bleeding. Also infrequent bleeding can happen after 1 year. So what problems can cause someone who has got an implant to switch off from it? Those patients who experience unexplained vaginal bleeding, you can switch off, switch to another method. Those who have got migraine headache, the cause of migraine headache is unknown, but most of the time associated with hormones. Those with cholangioplasty, those with ischemic heart disease, and those ones suspected to be pregnant. Yeah, what are the complications and their management? Yeah, she might have infection at the insertion site. Some implants can get exposed. Then they might be difficult removal when it is time for removing. Yeah, summary or take-home message. Implants provide long-term protection. They are highly effective and readily reversible, appropriate for most women, including young girls and nulliparous women. Irregular bleeding patterns may be a problem for some women. SARA counseling is very essential. Thank you.